I have the privilege of working with Randy on this very important project, pulling together all of the information that we hear anecdotally as far as wait times to be able to get in to see a provider, and then some providers saying that they are taking new patients, but in reality they're taking cherry-picked patients, patients with commercial insurance. They just simply can't afford it with the low reimbursement rates to take Medicare and Quest patients. And I did want to share one statistic right off the bat. 30% of our population in Hawaii is currently on MedQuest, which is 100,000 more than we've ever had before. Judy Moore Peterson said that during the pandemic, we were still being able to keep up with those, but she said that once the community opened up and people were going to be going back in and getting services that they put off during COVID, that we were not going to be able to keep up with the demand. And that is what our survey is showing, is that very extreme wait times, 4 and 6 months for folks to get in for cancer screenings and treatments. Our folks are dying on the neighbor islands at a greater rate than they are on Oahu, and we die of things that they don't die of on Oahu, and they certainly don't die of on the mainland, and that's just not what our community deserves. We really wanted to get the community voice involved in this. There's been a lot of outreach and push from the provider community to let our policymakers know that they struggle with low reimbursement rates, the burden of the general excise tax. As you may be well aware, the hospitals and the FQHCs are not burdened with the general excise tax, but we're putting that on solo and small practice providers who are providing the frontline services to our community members. And then the general excise tax, based on the survey, community members are putting off care, and it's primarily our Native Hawaiians, our Asian Pacific Islanders, our Hawaiian Pacific Islanders, because they have to make the choice. They don't know how much the additional fees are going to cost them or what that tax is going to be, and so they put off getting preventative services. They're not getting their screenings, have higher incidences of chronic conditions. They just accept that when they're in their late 20s, early 30s, that it's okay to get an amputation due to the diabetes instead of getting their medications with something that could very well be managed. And that is, we need to change it. And that's why we're doing the Access to Care project. We collected 2,248 surveys. 225 of those were from providers across the island. And on the initial results, so one of the questions we ask is, what is their perception of the health of the community? And 45% of our residents categorize it as unhealthy. So 4 in 10 people feel that way. And then the majority of the providers surveyed, over 90% of them are full-time practicing on Hawaiʻi Island. They flip those numbers because they're taking care of those chronic conditions. And 59% deem the community as being unhealthy. But affordability of insurance and medical care came in at 55%. Which is really showing that we need to do something to make it more accessible for folks to get healthcare services. So workforce shortages came up as a huge indicator. More than, 76% of community members said that they can't get care because of lack of access of providers within the community. And their waiting times, you can see on the chart that's on the screen, are waiting more than a month. And in fact, what we're hearing is for referrals to specialists, folks are waiting 4 and 6 months in order to get in with a specialist, and that's including cancer care. But I just actually received an email yesterday from a woman in her early 60s that waited 4 months to be able to get in to get a diagnostic treatment, and she definitely has cancer, and it's an extreme one. And so that's heartbreaking. And so working through her providers to see if we can get her voice elevated so that we can start highlighting that these are real people behind these numbers. So more on that. But we're experiencing shortages across the spectrum. It's not just physicians. It's our, community health workers, first of all, should be reimbursed through insurance. Bottom line, because we need our patients to have the coaches and that management. So that's one of the things that we're seeing rise to the top. But for providers at the state level or our state legislators when they say, oh, well, we'll just use APRNs or PAs to provide primary care if our providers reduce hours, leave the island, or go to the mainland, right? So if we don't have enough physicians, we'll use our mid-levels, but we have shortages of mid-levels. And then when we look at telehealth services, we just had a primary care provider leave our state in the end of December. She was providing more care via telehealth to mainland patients to support her primary care habit, right? There's radiologists in North Hawaii that are only seeing and reading scans from the mainland because they get better reimbursement rates. They're not seeing patients in Hawaii. So when we look at the list of folks that carry licenses within the state, when we scrub that list down to those that are actually taking care of patients, our shortages are much larger than what they appear to be. So working with the congressional delegation is very important. Things like the health profession shortage area designation that we worked on through Community First to get countywide. We were actually successful in getting countywide designations through the entire state. So a lot of the things that we work on here on Hawaiʻi Island are actually benefiting our entire state. We've heard recently about 2 physician assistants on Maui that are going exclusively to providing care online via telehealth. So that is a slippery slope. It gives us access, but it also prevents access. And those that need to access the most, what we found in our survey is that the elite white citizens that have good broadband can access telehealth, but those that live in more rural and remote areas do not have the access to it. So in the survey results, obviously, we've always had some mental health shortages as far as providers, but during COVID, we're seeing that exacerbated. Even in our younger populations down to elementary are really struggling. Through the Rural Health Association, we developed a program called U Telehealth, which is providing free mental health and behavioral health counseling, and we can also prescribe, the providers can prescribe for substance abuse as well, but that's not solving all of our issues. So widespread shortages across the spectrum, especially with specialists, social services as well. And then, of course, the economics, which I also touched on. So you can see, you've probably already taken a look at this, but we have equity issues as well. And then how are our patients impacted? So they're sicker. So I kind of wrapped all of this up just talking off the top of my head and not going off of the slides. This one is frightening. So this is from our providers. 49% of those surveyed are considering reducing hours. 47% are considering leaving medicine altogether, and 44% are preparing to move to the mainland. So it's not all gloom and doom, because we do have good relationships, and like I said, we're launching, here's our postcard that, you know, we're getting out all over the place, but we really want to form that broader voice to be able to form systems of care, and as Randy likes to call it.
Yeah, so the vision again was to ensure that everyone on Hawaiʻi Island, right, has access to quality healthcare, timely healthcare close to home. So what that would require is all of our provider groups kind of working together. And the great thing is that during COVID, we saw that. I mean, we saw a lot of people that normally don't work together actually come together, share information about what each one is doing, you know, see how they can kind of work off of each other so that we're not, again, missing, any groups out there. What the survey will show us is where these gaps are and how can our providers, again, right, work together, in a way that across the island, because, one is we're a very big island, we're very spread out. We have a lot of rural areas with access issues. Transportation is one, right? So our medical, our social service providers, in a way that puts the community at the center of it all, right? It's not necessarily their bottom line, but what's best for the community. So our goal is, again, to convene everybody, to want to come together and learn about how everyone can play a role in providing better access. And, again, the challenge is huge because, again, we're facing workforce shortages, physician shortages as well. So that part is another piece that needs to be addressed as well. But I think it all starts by, we all working together.
Yeah, the other piece is we're getting information from the insurance companies as far as what's being flown off island by procedure code. So we are engaging with the organizations, both the Department of Health, the FQHCs, the hospital groups, to be able to really understand where insurance companies can put their recruiting dollars. So if we have the population to support a specific specialty, then that's what they can recruit for, right? So it's more targeted. And then forming sort of centers of excellence, I think Randy calls them, where you can provide a certain type of medical service. So with Hilo Medical Center having 2 catheterization labs now to take care of hearts conditions and do stents and vascular surgeons and all this type of thing, it doesn't make a whole lot of economic sense to also set it up in North Hawaii and also in Kona, because you have to get the equipment, you've got to get the 3 cardiologists, and then you need all of the support staff to go along with it. So if we can form those centers of excellence for certain pieces of healthcare across the island, then we can look at where to best put our economic resources. So then, maybe it's a trauma helicopter to be able to fly people to where they need to be to get that particular type of care. So really working smarter, not harder, and then having that collective voice across the neighbor islands to pull resources from Oahu to the neighbor islands. But unfortunately, what we're starting to hear is they're having similar shortages on Oahu. So,
Yeah, I think we refer to it as just keeping as much healthcare as local as possible, right? So if we can afford it as an island, and it'll prevent, or at least give people an option of not having to fly, then that's what we want to do.